Okay, it's my pleasure to have with us here today Dr. John Koster, who is a leader in public health policy in the series I'm calling Reflections from Pharmacy Leaders Advancing the Profession. Dr. Koster is the director of the Division of Pharmacy for the Center for Medicaid and the CHIP services of the CMS Center for Medicare and Medicaid. He's had a very long career in public policy. He previously served as Senior Vice President of Government Affairs at the National Community Pharmacists Association, NCPA, and also was a staff member on the U.S. Senate in the Special Committee on Aging. And when he first started off in this area, he completed the ASHP Executive Residency in Association Management. So it's my pleasure to welcome Dr. Koster with us.
Thank you.
So as part of this, the first question, we would like to learn more about your journey to in your career, to your recognition as a leader in public health policy. And in reflecting on that, you may wish to think about key events or persons which influence you in this journey.
Okay. Well, I think most of my influence came very early on as an active pharmacy student in student APHA, which is what it was called back in the 80s. I was national president of student APHA. That was 1983, 84, so a long time ago. And then I decided to apply, as you said, for the SHP Executive Residency in Association Management, which brought me to Washington and got me very interested in public policy. And I actually pursued a PhD in public policy at the University of Maryland Graduate School in Baltimore. After I've, finished the executive residency, I went to finish my PhD, and I did my dissertation on a law called the Medicare Catastrophic Coverage Act, which was enacted in 1988. I got to meet a lot of staff on the Hill, Capitol Hill, and in agencies. And then I went to work for the Senate Aging Committee, which you mentioned as well. So my interest in public policy and public health was formed early on as both a leader at my pharmacy school and national president of student APHA, and then doing the executive residency in association management.
Very good. Well, thank you for that. Mm-hmm. So what do you believe will be your legacy in 20 years? And I rephrase that question because sometimes people will say legacy. Reflecting on your career, what are you most proud of in terms of your contribution that has really helped advance the pharmacy profession?
So I think my work on Capitol Hill in helping to develop the drug counseling provisions of over 90. I assume pharmacy students are taught about the origins of where the state pharmacy practice counseling laws came from. So as part of what I worked on Capitol Hill was a law that was called Over 90. It was a large law. It wasn't only specific to pharmacy, but it required that pharmacists counsel patients in Medicaid on all their prescriptions. And that was eventually adopted by most states to be extended to all patients. So I think in terms of where pharmacy is now, we're much, much more advanced, of course, but that was one of the beginnings of the growth of the profession in terms of being more patient oriented. So I think that's something I look on and think that, proud of doing that. And also the work that I did in the pharmacy community as a regulatory professional and lobbyist, and trying to educate members of Congress and regulators about the contributions that pharmacists can make to public health. And I think those are paying off now as we see, states and the federal government look to pharmacists to help manage, this pandemic outbreak in terms of testing. Pharmacists are being looked at, I know, by CMS as a key part of helping to get us back to normal, whatever that's going to look like, by helping to do more testing of patients to determine if they've been exposed to COVID. So that's what I would say. I think I would want to be known for in terms of the pharmacy profession.
Very good. Thank you. So advice for students in their professional journey as they develop as leaders.
Say that again. I'm sorry.
Advice for students
Oh, advice for students.
as they develop in their professional journey.
Yeah. So I think it's important to be a leader, and leadership has different varieties, forms, and shapes. It doesn't always mean you have to be out there in public necessarily giving speeches or things like that. I mean, leadership can be that in terms of like broad leadership, trying to influence masses and things like that. But leadership also begins at home, in your own practice setting. So, and sometimes, the greatest change comes from the smallest areas. So I'd say look for ways in your career that you can do things differently. That don't be afraid to try different things. Don't be afraid to think outside the box. I knew from an early stage that I wanted to be a pharmacist, but that I wanted to use my pharmacy skills in a non-traditional sense, a non-traditional role. And I think I've done that. So I'd say, have broad horizons in terms of what you do with your professional career. Think outside the box, look for opportunities, don't be afraid to take a challenge. You might, it might not go smoothly, but that's part of the learning process. So I'd say think outside the box, look for new opportunities, look for new ways to apply what you know to help advance the public health.
Mm-hmm. Very good. Thank you. So you've already alluded to this, but I'll ask it again anyway. This is a history course in pharmacy leadership. And as we study the decades of the 2020s, one of the key events in that decade will be the COVID-19 pandemic, which we will, like other major events in our history of the profession, key events that happens in the world has shaped our profession. How do you see this being an opportunity for the pharmacy profession and will shape our profession?
Yeah, so I know that the agency CMS views, as our administrator does, views pharmacists as a critical player, not only in helping to help patients better manage their drugs, but also I think they view them as a key part of helping to manage this pandemic. If you look at some of the documents and other things that we've put out over the last several months, it clearly envisions a broader role for pharmacists in testing. That pharmacists are the most accessible professional. Fortunately, they're essential businesses. You can still go into any pharmacy today and not only get your prescriptions filled, but hopefully pretty soon you'll be able to get, if you need to, get tested by a pharmacist to determine if you're, if you've been exposed to COVID or not. So, sometimes, unfortunately, it takes something like this to really focus attention on the potential for a particular profession. I think everyone knew pharmacy had a lot of potential, but sometimes getting that potential takes a longer time than you'd like. And something like this, while again unfortunate, maybe the spark that was needed to really focus the public health community on what pharmacists can really do in terms of helping to manage this pandemic.
Mm-hmm. Very good. Thank you very much. Well, thank you, Dr. Koster. I appreciated that. It's been our pleasure.
Great. Thank you very much.